There's a silent health crisis in America, and it's the fact that on average American men live sicker and die younger than American women. It's a shame. Our life expectancies are 5 years plus less than women, and that number's been increasing over time. In 1920 it was 1 year, so now there's a 5-year gap in life expectancy. 8 out of 10 top 10 causes of death affect men more than women, and there's a greater risk of serious chronic diseases, things that are going to impact quality of life, and we suffer from them at an earlier age. Why? Well, the facts are, men are half as likely to see a doctor for a checkup compared to women. Most men feel that they're healthier than their peers. So there are self-reported questionnaires that are given out to men, and consistently men rate their health as good or very good. It's probably not the case. 7 million men haven't seen a doctor in 10 years. We go to the ER less often. We have shorter hospital stays. We don't complain about things. Employed in more dangerous occupations, so that can be a real big problem at younger ages. We engage in risky behavior, typically at younger ages, and we're just less comfortable talking about health, so we'll kind of hit on all of these points. Dr. Stepanian, urologist. We're going to be speaking a little bit today about Men's Health Matters. I appreciate the opportunity to be here. Thank you so much for the invitation. A lot of big shoes to fill, it seems, a lot of dynamic speakers, which is fantastic. When I was asked to give this talk, I've given talks like this before, but not necessarily in settings like this, so I had to get outside of my comfort zone a little bit. But you know what? Sometimes you got to get outside of your comfort zone to help yourself and to help other people. So that'll be a theme that we'll see as we go on in this talk. So a little bit about me, local boy, well, kind of local. Born and raised in Granada Hills down the street. As Les mentioned, UCLA for, we can go to the next slide, undergraduate, medical school, and residency, and then I performed a fellowship in Seattle in robotic and laparoscopic surgery. Was in private practice for a little bit in Santa Clarita, and then joined Facey Medical Group in 2017. We can go to the next slide. The agenda today is going to be to highlight some differences in health between men and women. We're going to discuss why these differences exist. We're going to talk about various preventable diseases that I think are important for you to know about, important for men to know about. And then we'll do a deeper dive into prostate health, kind of hit my stride there, and then we'll talk about some action plans, okay? All right, we can go to the next slide. So facts. There's a Men's Health Network. It's online, you can find it, a lot of good resources there. The founder, Dr. Davis Gramillion, has a quote that's been used for a long time. It's called, there's a silent health crisis in America, and it's the fact that on average American men live sicker and die younger than American women. It's a shame. So men die our life expectancies are 5 years plus less than women, and that number's been increasing over time. In 1920 it was 1 year, so now there's a 5-year gap in life expectancy. So we die at higher rates than women from the top, the 8 out of 10 top 10 causes of death affect men more than women. And there's a greater risk of serious chronic diseases, things that are going to impact quality of life, and we suffer from them at an earlier age. Okay, next slide. So why? Well, the facts are, men are half as likely to see a doctor for a checkup compared to women. Most men feel that they're healthier than their peers. So there are self-reported questionnaires that are given out to men, and consistently men rate their health as good or very good. It's probably not the case. 7 million men haven't seen a doctor in 10 years. We go to the ER less often. We have shorter hospital stays. We don't complain about things. Employed in more dangerous occupations, so that can be a real big problem at younger ages. We engage in risky behavior, typically at younger ages. And we're just less comfortable talking about health, so we'll kind of hit on all of these points. Next slide. So more health disparities. Why is this happening? So is it just genetics, or is it just bad choices? Well, it's a combination of both, but it's actually thought that genetics and biological factors only account for about 1/4 of these differences. And social and behavioral determinants explain the rest. That's 75%. That's a big number that's potentially modifiable. So diet, inactivity, alcohol, tobacco use, behaviors, healthcare utilization, and then just certain behaviors that are baked into us and expected of us because of being a man. Next slide. So we typically are as men, socially conditioned to neglect pain, to neglect disease. We are sort of taught to keep things in, to ball things up on the inside, and not show weakness, in quotations. So in our 20s, we think we're indestructible. In our 30s, we're busy with our careers, busy with our families. In our 40s, we might start getting warning signs, but we're afraid, and we don't go in and get checked out. And by the time those sounds get louder, that knocking gets louder in your 50s, sometimes it's too late. So you really have to take charge of your care and protect your health, because you need it to be your best self. You need it to be the best for your community and your family. Okay, next slide. So goals today, we're going to heighten awareness of various preventable health problems. We're going to talk about early detection, early treatment, real briefly. We're going to encourage you, obviously, to seek regular medical advice and early treatment for disease. More than half of premature deaths in men are preventable. If you don't know that a problem exists, you can't fix it. You can't correct it. You can't reverse it. Okay, next slide. So leading causes of death in men, in US men in 2022. It's a busy slide. The numbers aren't as important, but we'll talk about the top ones. So heart disease, over 25% of deaths. That's heart attacks. Cancers, 22% of deaths. Those are the big two. Unintentional injury typically affects younger men, about 10% of all deaths. COVID is kind of a recent spike. I think that'll drop down as time goes on. Stroke, number 5, lung disease, diabetes, mental health issues leading to suicide, Alzheimer's disease, liver disease, kind of round out the top 10. So we'll talk about some of the top ones here. And we'll talk about some of them because they are more relevant in terms of behaviors that can help modify some of the outcomes. Next slide. So let's talk about heart disease. Leading cause of death for men in the US, more than 25% of all deaths related, all male deaths in the US. Average age of the first heart attack is 65 years old. Of patients who are under 55 who have their first heart attack, about 75% are men. So it tends to affect us earlier in life, and it certainly leads to poorer outcomes in men. It's important to know because there are lifestyle modifications that can prevent up to 80% of heart disease. So smoking, high cholesterol, high blood pressure, diabetes, which is poor control of blood sugar, often a diet and activity-related disease, physical inactivity, these are major risk factors. So this is just informational. We'll talk about stroke. Stroke, while not a leading cause of death, it's the 5th leading cause of death, but it is a big impact to men in terms of long-term disability. And when men have strokes, it tends to be a more disabling event than in women, and their death rates are higher. Same things as heart disease with regards to risk factors: smoking, cholesterol, high blood pressure, diabetes. Again, all of these things that potentially can be reversible or preventable with behavior modifications. So 38% thought to be preventable. Huge numbers when you talk about the death rate. Diabetes, primarily a disease that's brought upon by inactivity and diet. 7th leading cause of death in men, kind of impacts the whole body. When the blood sugars are elevated, blood vessels can become brittle, nerves can become injured, kidneys can fail. Really common reason for kidney failure and dialysis, which is a really poor outcome in terms of quality of life. Risk factors, again, overlap with those of heart disease. And diabetes is interesting because you can actually reverse it. So if you're kind of borderline, or you're there's several cases that, a big percentage of cases that can be reversed with diet and lifestyle modifications. So medications are out there, but why not reverse the disease process if you can? So the last thing we'll talk about today, just briefly again, is just colon cancer. I bring it up. It's the 3rd most common cancer in men, and I bring it up because while the rates are kind of declining, we're starting to see early onset colon cancer in young men between the ages of 20 and 49. It's rapidly rising, and there's a steep increase in men under 40. We don't know why. We're kind of stumped, and we're trying to figure it out. It's probably related to diet, but it's kind of a little epidemic that's happening, and it's a big problem. Colon cancer generally 33% more common in men than women, but screening colonoscopy is a very effective tool in identifying disease, ruling out disease, identifying disease early. It used to be 50, as the recommended age for screening colonoscopy. It's dropped down to 45. It may drop down even further. And remember that a screening test, a colonoscopy, if it's offered to you as a screening test, means you haven't complained about anything, right? No symptoms at all. It's just time to get it done. So if you have any sort of symptoms, then that colonoscopy can certainly be initiated earlier. So potentially diet, lifestyle modification can impact cases. Not clear, but important to know about colon cancer. All right, so we're going to shift gears a little bit here and talk about prostate health. So we can go, I think, 2 slides ahead. Are we there? There we go. Actually, we go back one. Yeah, let's stay there. Okay, so prostate health. What's the prostate? It's a walnut, golf ball shaped sized organ that sits right below the bladder. It's kind of highlighted in blue there. I don't know if you can see it. And it surrounds the tube that we urinate through. So it sits below the bladder, in front of the rectum, surrounds the tube that we urinate through. It makes fluid that's part of the ejaculate. It's part of our sexual sort of function. Why does it matter? Why do we even talk about it or care about it? Next slide. Well, we talk about it because things can commonly go wrong with the prostate. And we're going to try to demystify it today and really break it down into like 3 big things that can affect the prostate. And that's really all there is to know about it. So commonly, infections can occur, urinary difficulties arise from an enlarged prostate, and prostate cancer can develop. And again, these things are very common. 40% of men in their 50s have urinary issues related to an enlarged prostate. And when we talk about prostate cancer, it's the most common men's health cancer. 1 in 9 men are diagnosed with prostate cancer. It's an 11% lifetime risk. It's huge. Okay, we can go to the next slide. So these are the 3 conditions. Prostatitis in green, enlarged prostate in the middle, prostate cancer on your right. So we'll talk about each of these independently, but it's also important to know that each condition is independent of the other. So each condition affects the prostate differently, and just because you have one doesn't mean that you'll have the other. So a lot of my patients will tell me that, well, if they feel like they have an enlarged prostate, does that put them at risk of having prostate cancer? Not necessarily. It's completely different. It's not in fact true. So we'll talk about prostatitis, which is really just an inflammation or infection of the prostate first. So we can go to the next slide. And then we'll go to the next slide. So 2 broad types: infectious, related to bacteria, and inflammatory, related to reasons we don't really know. Prostatitis, we'll go to the next slide. When there's an infection, it can be acute, meaning it happens rapidly, or it could be chronic, where it's kind of smoldering over time. And there are theories as to why this can happen. In theory, it should be a sterile space, but there can be bacteria in the urine that seeds in the prostate and just doesn't get cleared out of you, and then it can become problematic. So what are the symptoms? We'll go next slide. Fevers, chills, in acute prostatitis when there's a rapid infection, burning, frequency, urgency, cloudy urine, pelvic pain. Oftentimes patients will tell me they just feel like something's wrong down there. It's a really common description. There's also pain potentially in the bicycle seat area of the body. It's called the perineum. Sometimes it can lead to flu-like symptoms. We'll go next slide. So risk factors: weakened immune system. There are some conditions that can weaken your immune system, autoimmune diseases, sometimes medication use like steroids. Diabetes can in fact weaken your immune system. If you have a history of urinary tract infections, if there's a urinary blockage, these are things that can impact or increase your risk of developing prostatitis. So the way we make the diagnosis, next slide, is typically with discussion. So oftentimes we can make the diagnosis just by talking to the patient and understanding the history. But we also sometimes will fall on doing a prostate exam, which is a finger in the rectum to feel the prostate. And while it's not a comfortable exam, when there's prostatitis, it often is a very painful exam, and it can elicit some of the symptoms. Occasionally we'll do blood and urine tests to kind of make the diagnosis if it can be a little bit tricky otherwise. Next slide. So treatment, it's antibiotics, and it's long-term. It's 4 to 6 weeks of antibiotics, and the reason why the antibiotic course has to be so long is that you need the concentration of the antibiotic to reach a certain level in the tissue to destroy the bacteria. And so Takes about 4 weeks or so for that to happen, sometimes 6. And I often tell men, if you're on this 4-week course of antibiotic, you may not start to feel better until week 3 or 4. So it can be really frustrating disease process. Occasionally, if oral antibiotics don't work, then IV antibiotics are needed. Okay, so next slide. So there's a whole another category of prostatitis, which is even more challenging for patients and more challenging for physicians, is an inflammatory prostatitis. We don't exactly know why this happens, but the prostate can get inflamed. And it can lead to very similar symptoms that a bacterial prostatitis results in, minus the fevers and chills. So next slide. Symptoms can include pelvic pain, penile pain, pain in the perineum, the bicycle seat area, low abdominal pain, sometimes pain with sexual activity, difficulty urinating. And it's frustrating because the symptoms can come and go. Oftentimes when you see us, or by the time you get in to see us, the symptoms may be gone. And it can be a challenging problem to diagnose and a challenging problem to treat. Next slide. For inflammation of the prostate, if we've ruled out a bacterial infection, there's no accepted regimen. Oftentimes it's just trying to get your symptoms under control, and it's a combination of therapies. Sometimes behavior modifications, sometimes medications to improve the urination, sometimes anti-inflammatories like Advil, ibuprofen. Antibiotics sometimes we do as well, even though there isn't good data to suggest that it's a bacterial infection, sometimes it can be helpful. Other sort of non-traditional therapies are out there like acupuncture, physical therapy, over-the-counter supplements, warm baths can help. It can be a tough one. Okay, so we'll go to the next slide. So that first condition about the prostate, prostatitis, infection or inflammation of the prostate, not a cancer. Infection usually causes a rapid change in symptoms. Long courses of antibiotics are often required. And inflammation of the prostate, if it's non-bacterial, can be a challenging disease to treat and often involves many forms of therapy. Prostatitis generally also, I didn't include this in there, but generally tends to affect younger men more so than middle-aged or older men, although it can happen in any age group. Okay, so we'll move on to the next condition. Next slide. So this is an enlarged prostate. We often call it BPH, benign prostatic hyperplasia, and it's a non-cancerous growth of the prostate. Completely unrelated to prostate cancer. Next slide. So again, non-cancerous, very common cause of urinary symptoms. And it's a fact of life. The prostate will just grow in response to age, in response to male hormone, to testosterone. So the longer you live, the longer that testosterone's around in your body and impacting the prostate, the more growth you're going to get. So we'll go to the next slide. It's also important to know that just having a big prostate doesn't mean that you'll have the symptoms. So I have some men in my practice that have very large prostates, but they're doing fine, and they don't necessarily need any treatment. And that's important because the size, again, doesn't always matter. Sometimes the anatomy and the way the prostate is interfacing with the urethra, the tube that we urinate through, and the bladder make a difference. It's really about how things are being squeezed. So let's talk about the symptoms. Next slide. It's probably a common one. You guys see? All right. We'll go to the next slide. T time, not P time. All right, so BPH, benign prostatic hypertrophy, enlarged prostate. What are the symptoms? Frequent urination, multiple trips to the bathroom day and night, urgency sometimes causing leakage, not being able to make it to the bathroom on time, waiting to get your flow started, going to the bathroom at an event and seeing a bunch of guys come in and out and leave before you do, you probably have an enlarged prostate that's causing some symptoms. Slow flow, intermittency, starting and stopping, dribbling afterwards, or sometimes feeling as though you're not completely emptying your bladder. Okay, next slide. So, very common. Prior to the advent of medications to treat an enlarged prostate, surgery to treat the enlarged prostate was the most common surgery performed. More so than appendectomy, gallbladder removal, it was the most common surgery because it's a fact of life. And it becomes increasingly common, BPH, as you age. So if you're in your 50s, 40% affected. As you age, and in your 80s, 90% infected. And questionnaires that go out suggest that this is probably a couple years old, this data, but 21 million men that suffer from moderate to severe symptoms, but only about 12 million that are being treated. So there just isn't a lot of discussion about this, especially these days in medicine where it's so tough to access care. And when you go see your doctor, you might feel like you're in a mill. You're just in and out. These sort of symptoms get pushed down, right? The quality of life discussions get pushed down on the list of important things to talk about. But you know what? They are important. They impact daily living. And so if you have these symptoms, you got to be your own advocate and really bring it up when you're at your doctor's office. So again, why does it matter? Next slide. Quality of life, primarily. Disruption of daily activities. There's no need to settle with these symptoms. There are a lot of great therapies out there. I'm a surgeon, but surgery is not always the right answer. And I know that can be a difficult sort of thing to go through with surgery, but there are a lot of different ways to manage it. Quality of life is primary, but there can be health consequences. So infections can develop if you're not emptying your bladder all the way. Bladder stones can develop, urinary leakage, kidney failure, bladder health deterioration, and sometimes more subtle things like isolation, right? If you've got urinary frequency and you don't want to leave the house, or you have leakage and you don't want to leave the house or go to a movie or do things that you used to enjoy, that can really impact you physically and emotionally, and you can start to lose your sense of community, right? That could be a problem. Okay, next slide. So what's the evaluation? Well, if you bring up any sort of symptoms about urinary any sort of signs or symptoms of urinary problems with your primary care physician, you should have a basic evaluation performed. Typically a physical examination, blood, urine test. You want to rule out those dangerous health issues that could be a result of an enlarged prostate. So we want to rule out infection. Although it's not related to cancer, typically you want to get screened for cancer or any sort of severe disease. Oftentimes urologists will perform procedures in the office where we put cameras inside and take a look. It sounds scary, but it's super quick and easy. And then there are other tests that we do. Yeah, it says to me, I know. So, and then there are other tests that we can do in the office where we measure your flow rate and kind of the function of the bladder. Next slide. So management, traditionally the primary goal is to improve symptoms, improve quality of life. Recently, there's been a little bit of a shift more towards trying to preserve organ function. If you've got a pump and the pump is working against an obstruction, that pump's going to have to work harder over time to get past that obstruction. And eventually that pump could give out. And so sometimes you may not feel it. The pump is compensating for that obstruction, but you can reach a point where you fall off a cliff and then you can't overcome it anymore. Then you need a catheter and it becomes a more severe disease process. So there's been some shift to try to identify that early so that we can prevent those situations from happening. So management can oftentimes include nothing, just watching it. It can include medicines. There are minor procedures, there are major procedures. It all depends on the severity of symptoms, whether or not there are real sort of health issues at stake, and patients' risk tolerance, what they're willing to kind of go through. All right, next slide. So the last condition about the prostate we'll talk about is prostate cancer. Next slide. Prostate cancer is very common, thankfully very slow-growing cancer. We're going to talk about localized prostate cancer that's contained in the prostate. We'll talk about some prevention strategies, screening, diagnosis, management strategies. Okay, next slide. So prostate cancer, most commonly diagnosed cancer in men, 30% of all new cancer diagnoses in men. Second most deadly cancer in men, so it's lung, prostate, colon. Estimated about 300,000 new cases in 2024, 35,000 deaths in 2024, lifetime risk 11%, risk of death fairly low because we're pretty good at identifying it early, 2.5%, median age at diagnosis about 67. So next slide. Biggest risk factor, age. As the prostate grows, prostate cells can increasingly turn more cancerous. Peak incidence between ages of 65 and 79. Race has something to do, and ethnicity has something to do with your risk as well. African American men are more likely to develop prostate cancer and are more than twice as likely to die from prostate cancer. Family history increases risk. Diet, lifestyle, chemical exposures. We're not seeing Vietnam vets as often, but Vietnam vets who are exposed to Agent Orange had an increased risk. And then genetics may be involved. It's kind of a loose correlation, but it's there. Okay, next slide. So statistics, again, as you age, prostate cells are more likely to become cancerous. And autopsy studies in men who have passed from other reasons reveal almost a 30% prevalence in men between the ages of 30 and 40, 64% between 60 and 70. Now, if that's an important, you can take a couple things from that slide, right? These are prostate cancers that are found at the time of autopsy in men who have passed for other reasons, which kind of goes to show that prostate cancer can sometimes be also sort of be a fact of life and not necessarily impact lifespan. But it's important for us to make that determination, right? For you to have that wisdom and knowledge and for us to make the determination. Okay, next slide. So again, we talked about the lifetime risk. What's important, 91% diagnosed at a relatively early stage. 5-year survival approaches 100%, versus if you have disease that's outside of the prostate, the survival drops pretty significantly. So it kind of goes to show the importance of early detection and screening. Symptoms. Next slide. So prostate cancer, oftentimes no symptoms. It could be silent in its early stages. You can look fine, feel healthy, and not know that you have a problem. If there are signs, sometimes it can be blood in the urine. It can be changes in urinary habits, right? That can overlap with some of the non-cancerous things that we spoke about. There could be pain, which can overlap with prostatitis or infection. The inability to urinate, regular new types of pain, bony pain in the back, pelvis, ribs, upper thighs. So these are all things you should kind of look out for. If any of these things are there, you should get evaluated. So we'll talk a little bit about screening. That's the next slide. What's the goal of a screening test? The goal of a screening test in general is to find a disease before symptoms appear, right? And the idea is that if you screen for cancer and you find it early, it's going to be easier to treat. It's potentially going to be curable versus waiting for it to become advanced. Decreases the chances of dying from cancer, and here's the kicker, has few false positives and few false negatives. It's important to know that screening tests themselves don't always diagnose cancer. So the way we screen for prostate cancer, next slide, is with a blood test called a PSA. It stands for prostate-specific antigen. It's a protein that the prostate produces, and a certain amount of it gets released into the bloodstream. Cancer is one of those things that can cause more of it to get released into the bloodstream. So the higher the PSA is, the greater the likelihood of prostate cancer. It's an imperfect test, but it's the best one we have. It's really been used for prostate cancer screening since the 90s. And most cancers, the vast majority, are found because the PSA is elevated, and that prompts a workup. Okay, next slide. So who should we screen and how should we do it? Recommendations vary. There's actually a lot of controversy associated with using PSA as a screening tool for prostate cancer, but our American Urological Association guidelines don't recommend screening under 40. And again, screening is if you have 0 symptoms, right? You're just walking into the doctor and they're checking off a box for you. If you're between the ages of 40 and 54, we screen based upon risk. So family history, African American descent. 55 to 69, typically every 2 years, but it depends on what your PSA is at baseline. If your PSA is concerning at baseline, that might be accelerated. An examination can also be performed to help understand your risk. Generally, if you're over 70, we do advocate for screening, but if you have a life expectancy more than about 10 years or so. And these are conversations that we have with patients. We call it shared decision making. There isn't always necessarily a right or wrong answer. It's about risk tolerance, risks, benefits, and then we kind of make a decision about screening. At least I do individually with each of my patients. Okay, next slide. The dreaded, the rectal exam. So not recommended as a sole screening test. You combine it with the PSA, the blood test. It can be abnormal in a significant amount of cases, and 20% of cancers are found just because the exam is abnormal and the PSA is normal. So that kind of speaks for the PSA not being a great test, but you have this fallback that you can use, and once a year. All right, next slide. So prostate cancer, PSA screening, does it find cancer before symptoms appear? Yes. Does it allow you to more easily treat and cure when found early? Absolutely, right? Metastatic prostate cancer, typically not curable. Prostate cancer that's contained, typically curable. Few false negatives and few false positives, that's where it needs some work, that's where the controversy is, but it does decrease the chance of dying from prostate cancer. Okay, so we'll go to the next slide. Kind of make it quick here. Once you have a screening test that's abnormal, generally if there's concern, we'll offer an MRI of the prostate. It's kind of similar to mammograms that women get for breast cancer, and then ultimately a biopsy of the prostate. We can go to the next slide. So prostate cancer management solely depends upon risk, right? So anytime you face any sort of problem in life, your instinct is to kind of take a step back, right, and get a sense of how serious the problem is. And so for prostate cancer, that's called risk assessment. There's low-risk prostate cancer, intermediate, high, very high. And that's really the foundation to discuss management. Depending on what risk group you're in, you have various options available. Life expectancy also matters. There's a lot of prostate cancer that's so slow growing that it may not make a difference, depending on where you are in your life. All right, next slide. So prostate cancer management options. It's a whole talk dedicated to this, but generally it might be active surveillance, just keeping an eye on the cancer. It could be treatment with the intent to cure with radiation therapy or surgery or ablation. Overall survival for low-risk disease, 95%. Early detection is key. All right, so we're going to shift gears a little bit here. Next slide. Okay, so we're just going to talk about health in general here and what the men's health problem is. The challenge is Aldous Huxley, British philosopher and author, that men do not learn very much from history is the most important of all the lessons of history. All right, so I need to reiterate, right? You're your best advocate. When it comes to health, you're not alone. Don't let history repeat itself. You got to break the cycle. So preventative care is wisdom, right? You can't go into a situation blind. You're not going to make good decisions about yourself. So annual checkups, you should see them really as an act of foresight, right? Catch problems early, take care of those problems, and be responsible. Be responsible to yourself and to your community. We talk about, in lots of different aspects of our lives, marriage, raising children, careers, about planning, preparation, accountability. Why shouldn't we do that for ourselves when it comes to our health? We absolutely should. So I didn't talk about mental health, but I want to throw this out there that mental health does matter. There's stress, anxiety, depression that are related to health issues, right? And potentially related to just holding everything in and not talking. And then you just kind of explode. You get crabby and, or you have worse mental health issues that are quite serious. Those things should not be ignored either. They're very common. They can be treatable. Community support. They're not personal failures. Community support and talking can help. Okay, so let's go to the next slide. All right, so I want to challenge something, which is the definition of strength, right? What is strength? So the old definition of strength is not complaining, not needing help, pushing through, being silent, not having difficult conversations, and just handling everything alone, right? If you ask for help, it might be seen as a sign of weakness, but I challenge that. The new definition of strength should be taking responsibility, right, for what matters most, including your health. That's really important. You want to be present. So next slide. Being ignorant, that's not strength. Putting your head in the ground, not paying attention to your body, that's not strength. May be born out of fear, but it's not strength. So, we're thought to sort of push through. When it comes to health, that mindset can backfire. Because once it's too late, it's too late. You can't make up that ground, right? So seeing a doctor, getting screened, it's maintenance, right? It's how you, as a strong man now, stay strong. For you, for your family, for your community, for your brothers, right? So that's important. Okay, next slide. So fear. So fear of bad news, judgment, fear of appearing weak, that leads to avoidance, right? You don't want to be vulnerable. Most men don't avoid doctors because they don't care. It's because they're scared, right? They're scared about what they're going to hear, and they don't want to deal with that. And as those warning signs sort of become louder and louder, again, it can be too late. But courage isn't experiencing fear, right? That's a natural reaction to a lot of different situations. It's being able to act despite having that fear, right? So if the fear cripples you, that's a problem. Being courageous is pushing past that. Okay, so let's go to the next slide, which I think is really important, and it's the power of conversation. So most men, we don't change if we see a pamphlet or a poster, or even if you see this slide deck, right? We change because of typically conversations that we have with other men. Unfortunately, we don't have these conversations enough. When I walk through the hospital at Henry Mayo, there are pamphlets all over, and on the top of that pamphlet it says girl talk. Every month there's a girl talk session. I've never seen a locker room talk or a man talk flyer. It just doesn't happen. We don't do it, and that's a problem. So we need to get rid of the stigma associated with conversations. Think about how many times you've talked to a friend or a family member, a male friend or a family member, about your colonoscopy. Not saying you should do that at dinner, but the conversation should happen. So the conversation is not weakness, right? It's protecting one another. And being silent might seem strong in the moment, but responsibility is what's strong in the long run, right? So ignoring a problem is easy, but you don't want a bigger problem tomorrow where it's going to impact you and the people around you. So encouragement from peers, simple conversations, normalizing some of these health issues are important. In fact, 2 days ago, I was listening to Sports Talk Radio in the morning, Dan Patrick's show. Bo Jackson was on. And he, for the first time, revealed publicly that he had prostate surgery to remove his prostate for prostate cancer. And he's launched this whole initiative. I don't plug it, but he's launched a whole initiative called Bo Knows Men's Health. And he's got podcasts, and he's thinking about doing a tour. So like Bo Jackson, who was, Les, you probably know, like his injury, he was so strong, he pulled the bone out of the socket when he was running, because somebody was holding him, and he tore. So can't get a stronger man than that. And it affected him, right? And he actually talked about these conversations and why they're important. And next slide. Your health supports your long-term presence. He actually said, the most fun I've ever had, baseball, football, right, professional athlete. He said, the most fun I've ever had, and I continue to have, is being with my grandkids. And he said, I'd put all that stuff away. I'd throw all that away for that. So if I'm not here, what good is it, right? So your quality of life also matters, right? Because some of these diseases certainly impact quality of life. You can't be consistent. You can't be, if you're not healthy, you can't be consistent, and you can't be present. So it's an important thing to think about, right? And talk about. Okay, last slide. So, you're up. You got to honor the body that's entrusted to you, right? Choose prevention, choose wisdom, walk together in health. Schedule an appointment and have an honest conversation. Make one healthy change, right? So the mindset of burying things and not talk about it may have come from a good place, right? When we're young, that helps us survive. But as you get older, strength looks different. And as you get older, that mindset can work against you. Get checked out. Be present for yourself. Be present for your family. Be present for your brothers. Talk about these things. Protect your health. Thank you.